go.
Okay. Today we're going over Metapore dressings. Following our post-ops, we have our mid-sternal incisions with Dermabond. And so what we're going over today is just making sure that we can keep the integrity of the Dermabond in place so that we're not compromising that incision site. So the first thing you want to do is we have 3 different sizes of Metapore on the unit. So you'll want to take a look at your patient and the length of their incision and find which one is appropriate for your patient. So you can even hold them up. We usually have them in the drawer. This being an older patient, we're going to use the bigger one. So the next thing is to make sure you have scissors in the room and a Sharpie. So with our dressings, we're going to always want to keep in mind that you're also watching is like a drool dressing. So it's not going to hurt to have a little bit of your Metapore above this area, and you can cut down your adhesive, but you also want to keep in mind that we're covering that incision with the Metapore middle part so that you're not getting any adhesive on there. So you can go ahead and cut down and then label. We're going to cut this part at the bottom where there is some air. Usually you will have a chest tube or a chest tube suture. The idea is to secure it but not have too much adhesive on the patient's skin. Now I will label mine before I put it on the patient, and then I like to label on the adhesive portion of it along the side, and that's only because that way there's not going to be anything that can leak through in the Metapore and compromise that incision. And we'll date and time it. And then your initials. Then once again, you're going to come up here. You're going to put it up. It's not going to hurt anything in this area for the drool. Then you're going to go ahead and pull the dressing down. And then you're going to have it there. So everything is secure. It's breathable on this end. And that's what we're looking for, so that either end is not compromised, and you want to line it up in the middle. So once again, none of the adhesive portion is getting on that Dermabond.